Today we're talking with Dr. Vincent Hsu. He's the Executive Director of Infection Prevention at the Central Florida Division of AdventHealth. Dr. Hsu, thank you so much for being here.
Thank you, Garrett.
Let's talk about the spread of coronavirus. How contagious is it? How easy is it to catch it?
It is unfortunately a very contagious disease, which is one reason why we're having issues containing this. You know, exactly how contagious it is, we're not really exactly sure. We think it's somewhere along the level of influenza. Some experts say it's a little bit less contagious than flu. Some people say it's a little bit more. Nonetheless, it is something that is spread from person to person, so we all need to take those common sense precautions to prevent it from spreading to others.
Okay, so let's talk about how it spreads from person to person. What's the way of transmission?
So the most common way of transmission is through what we call droplets, respiratory droplets. When you cough or sneeze, there's always a little bit of saliva or sputum in which those viruses can be carried on. The good news is that it normally drops to the ground, so keeping your distance is a reasonable way to avoid getting infected from someone that might have the disease. We also think that people who are sick who touch their hands and their mouth may also contaminate surfaces, door handles, and so forth.
It's a natural thing to do.
And then another person who unknowingly touches that not knowing that there's a virus on there could touch their hands, and that could be spread that way as well.
So I know this is a very subjective question to ask, but which has spread more, the actual coronavirus or the fear surrounding the coronavirus?
That's a great question. I mean, it's really, there is a lot of fear going out because it is a new virus. We don't have as much experience with coronavirus than we've had with other viruses. And so that's understandable. However, I would say that there is a lot of reactive concerns. And I want to put this in context. Influenza, the common flu, for which there's a vaccine and antivirals are available, kills 15 to 60,000 Americans a year. Wow. So while we recognize that coronavirus is something that's new and does have some significance with respect to mortality, more Americans die from the flu every year than have been killed by the coronavirus worldwide so far.
So right now, and I know this is a constantly moving target, but right now, where are the areas of most concern within, let's say, the United States?
Yeah, so right now, there are pockets of spread, and we have to distinguish what we call community spread versus spread from a known source. So travelers who come from an affected area where coronavirus was circulating, for example, China or South Korea, if they come into the country and they're identified as having coronavirus because they're tested, we know where that came from. There are pockets of community spread, and a good example would be Seattle right now, which is experiencing some community spread. No one is exactly sure how that outbreak started, but that is an area where we've seen transmission. Some parts of California, and now more recently New York City has been spreading this. So those are areas of concern. Certainly, if a visitor or a person has been around those areas and are starting to develop cough and cold symptoms, that is a reasonable thought to say maybe I need to be tested for COVID-19. But I do want to say, and the public health authorities have been saying this as well, the overall risk of getting a COVID-19 right now remains very low in the United States. If you have the sniffles, a fever, cough, you're much more likely to have a normal respiratory virus than you are to have COVID-19.
Who is most vulnerable in the population if they catch COVID-19?
Yeah, I mean, the concern is that it is contagious. It's spread from person to person. Healthy people can catch the disease, but the concern right now are those that have underlying medical illnesses. Persons who are over 65, over 70 years of age, or those who have comorbid conditions such as diabetes, heart disease, pre-existing lung disease. We have seen in China, as well as in the United States, that those persons are at greater risk for developing serious disease and death. So it is really important that we do everything we can to protect those vulnerable populations from getting from spread of respiratory virus, any respiratory virus, not just COVID-19.
Thank you so much. I look forward to talking with you more about this.
Thank you, Garrett.